Welcome to Built Environment Assessment Training. The purpose of this course is to teach you the rationale for assessing physical activity environments and to familiarize you with specific measures for each type of environment. This course is hosted by the People, Health, and Place Unit of the St. Louis Prevention Research Center, located within the Washington University Brown School. Course content was originally developed and hosted by the Perelman School at the University of Pennsylvania. After completing this course, you will be able to explain the importance of assessing the built environment for physical activity, understand a variety of assessment tools for different purposes, and be able to use these tools to determine which best meet your project's needs, and understand how to adapt and to train others on the tools that are best suited to your work. So why measure features of our built environment? For one, the built environment is critical for physical activity, and physical activity is central to achieving and maintaining good health. The Oxford Health Alliance has been promoting a simple message that you can easily remember and pass on to others: 3, 4, 50. There are 3 risk factors: physical inactivity, poor diet, and smoking, which contribute to 4 chronic diseases: heart disease, type 2 diabetes, lung disease, and some cancers. And these diseases account for more than 50% of deaths worldwide. Physical inactivity and sedentary behaviors are serious problems all over the world and have been highlighted as important public issues because of their impacts on health. Recent guidelines and frameworks for physical activity have made the built environment a key pillar of producing positive change. These include the World Health Organization's Global Action Plan on Physical Activity and the United States' CDC Community Guide. For more information on the health impacts of physical activity and frameworks for improvement, take a look at the resources provided on this module's webpage. The ecological model of public health posits in part that factors or changes in someone's environment can influence their personal lifestyles. For example, the installation of a protected bicycle lane on the street in front of your apartment or home might make cycling to work, school, or shopping more feasible for you, and if it's more feasible, you might do it more often, increasing your level of physical activity. Many interventions to reduce the prevalence of chronic disease through physical activity promotion, however, occur on the individual level, focusing on behavior change and perception change regarding exercise, sports, active transportation, and other ways of being physically active. Individual-level interventions have been shown to be effective, but their focus on one person at a time means that they have moderate or little effect on population-level health outcomes. When working at the environmental level, researchers and practitioners can maximize and optimize the impact of various physical activity resources for larger groups of people. Even individual-level interventions might be more successful when people have a supportive environment. Because of this, research on how environments might promote or discourage physical activity has gotten more attention recently. This set of graphs shows how the focus of physical activity research has changed over time to reflect a growing interest in large-scale environmental factors such as policy and social determinants of health. More and more research studies are not only asking people to describe their levels of physical activity, known as self-report or subjective data, but are measuring and tracking it with devices that provide objective information. This is because people tend to over-report their levels of physical activity when asked. How physical activity is measured is critical to assessing the impact of the built environment accurately. For example, 3 U.S. surveillance systems collect information on physical activity prevalence. A study found that though 2 produced largely similar estimates of physical activity, 1 yielded a much higher rate. And we might conclude that the truth on physical activity in the United States is probably somewhere in the middle. This measurement is important for understanding where inactivity exists and how it can be combated. Internationally, the WHO estimates that 23% of adults and 81% of adolescents do not meet international guidelines for physical activity, and the Global Action Plan wants to reduce these numbers by 15% overall. In the United States, the overall prevalence of self-reported physical inactivity in the U.S., according to the BRFSS, is 25.3%, a quarter of the adults in the country. We can assume that physical inactivity is a bit underestimated here, since this is from self-report data. For more information on physical inactivity rates, see the resources list on this module's webpage. Rates of physical activity have remained relatively stable and low in the past few years, despite many interventions. And one of the reasons for the weak effects of these individual programs is that many environments create unsafe, inconvenient, or even impossible situations for physical activity. Environments that are safe, walkable, bikeable, and usable for exercise and active transit can make it easier to be physically active. It's crucial to broaden our focus beyond the individual and look to built environment. By changing built environments like schools, parks, and communities, everyone can be reached and impacted for the long term. This training will provide guidance on 4 methods to measure the built environment. Each has its own strengths and weaknesses and will give you different information. 2 are environmental assessments, where you look at the qualities or characteristics of an area to gauge facilitators and barriers to activity. 2 more are direct observation tools, where data collectors will observe what people are actually doing in a particular environment. Based on your project goals, you may decide to use more than one of these methods to get a full picture of how the environment impacts physical activity and health. There's no specific degree or credentials needed to assess the built environment for physical activity. With the training and tools provided in this course, anyone can evaluate the environment. You may need to look for others to help with some parts of the process, such as data analysis, but the actual collection of data is straightforward with the proper training. The reasons for assessing the built environment may be different for researchers, practitioners, students, and volunteer groups, but the way to go about it is more or less the same. First, it is important to clearly define what you wish to examine. There are many built environment features that could be related to physical activity, so you'll need to narrow your focus. This will lead to a streamlined project and proper utilization of the tools in this course. What you measure in the built environment will depend on your project's goals. For instance, do you want to examine access and usability of parks? Or are you more interested in measuring the differences of neighborhood built environment by socioeconomic status? Spend time upfront deciding what it is you want to accomplish and drafting the objectives of your project. Start by examining summaries of the built environment and physical activity literature, some of which you can find in the resources page of this module. You can also incorporate your own knowledge and input from the community. We strongly encourage you to visit the Active Living Research website. It's a great comprehensive resource to get you started. Once you know what kind of a built environment you want to assess, think about what you'll have to measure to understand health behavior there. For example, if you're interested in active transport, then you will need to measure community design, access to destinations, and characteristics of the transportation system itself, which support and hinder active transport. If you're interested in active recreation, you would need to measure a different set of environmental attributes. Access to recreation facilities, and probably the quality of those facilities, is a central concern. Aesthetics and natural beauty may also play a role in whether people use a space for play or exercise. Once you've decided on your measures and completed data collection and analysis, you should share what you learn. LEAD is an acronym developed by the Institute of Medicine, and it means locate evidence, evaluate it, assemble it, and let it inform decisions. One of the key aspects of this process is disseminating information to decision makers. Only one half of the work is done when results are complete. The other part is spreading information far and wide with the goal of generating action. Seek out the people who make decisions about built environments. You will find them in transportation, city planning, parks and recreation, education, and environmental protection departments, agencies, and companies. You can find some suggested formal and informal channels for dissemination in this module's webpage. A good example of the importance of sharing information at the local level can be seen with the Portland bike study done by Dr. Jennifer Dill. The local government had been investing in a variety of bicycle studies, and Dr. Dill studied where bicyclists rode in Portland by giving GPS devices to bike commuters. She found that they went out of their way to ride on roads and trails with bicycle infrastructure. When the city council learned about these results, they concluded investments in bike infrastructure were working and decided to triple those investments and set a goal for quadrupling the percent of trips made by bicycle in the region. In this case, data made a big contribution to a policy that is leading to more environmental changes and increased physical activity. Congratulations! You've completed the introduction module, and we hope that you'll go through all of the remaining modules in the training. Stand up and stretch, take a break, and get ready to enjoy the course. Please head back to the BEAT webpage to select a course to begin.